Jinja Regional Hospital is the second largest general hospital in Uganda. It is only second to Mulago National Referral in Kampala.
Jinja Hospital is one of the 13 regional referral hospitals. It is a 500-bed hospital and still growing. It serves a population. Our catchment area is about 4 million people. That is if we talk about the greater Busoga sub-region, but it also offers services as bordering to districts bordering Mbale and Tororo to the east, and our catchment area covers part of the Buganda region, that is across the Nile.
Jinja Hospital's 500 beds are occupied all time, and the hospital also attracts a huge number of outpatients.
Presently, as we talk now, this hospital serves about, we have said it's a 500-bed hospital, that's about 500 inpatients every day. And through our gates, we see close to about 1,000 outpatients. That is the adult, and the children. On the children's hospital, we see close to 200 children inpatient, and we see about 500 outpatient. Now, this covers all the special clinics that run in this place.
The national data shows that the number of cancer cases have increased in the country. This is majorly caused by the different lifestyle diseases which are rampant among the youths of Uganda.
Among the chronic illnesses that we are beginning to see is the burden of cancer. Those are neoplasias in this place. They are beginning to increase in numbers, and they are being confounded by the presence of HIV/AIDS. Now, when we talk about cancer, we have got the category is very broad. We have got childhood cancers, we have got cancers of the reproductive life or reproductive health, which actually falls in the what we would generally call gynecological oncology. Then we have got general cancers which fall in the surgical side, that is the surgical cancers, and we have got cancers that fall in the category of general medicine. Now, when we look at all these patients, they require very specialized interventions, which presently are not in this hospital.
The hospital lacks a cancer unit, and yet it receives a large number of patients with tumor complaints. This has triggered Twegaite International to get behind this essential cause of fundraising to set up a cancer center at the hospital. Jinja Regional Hospital directors signed a memorandum of understanding with Twegaite International on April 1st, 2013.
This is a unit that will be possibly the second in this nation. Uganda, with a population of 35, cannot afford to have only one radiotherapy unit at a national referral. It means access to care will be compromised. So we believe that if Jinja can be the second place to have a viable radiotherapy unit, we shall have gone a long way in not only alleviating the burden in Mulago, but we shall have improved quality of care or palliative care in this side of Uganda, and that means that we shall have stopped all the patients beyond the 12 districts we talked about. People in Mbale region will refer here, people in Tororo region will refer to this place, and the people in Soroti will also refer to this place, and possibly we can even talk about Karamoja and Lira. Now, that to me speaks volumes. We believe we need this radiotherapy unit very urgently.
When completed, the Jinja Cancer Center will work as a reliable option to Mulago, which is usually overwhelmed by cancer patients.
Mulago still has the largest cancer center, or the Cancer Institute of Uganda is in Mulago, and they have a burden of receiving patients from around the country. And all the infrastructure that we are talking about in Mulago and in this hospital were designed and were established when the population was still small, when Uganda was still at about 9 and 11 million. Presently, we are 35 million Ugandans, and therefore the demand for specialized services is beginning to increase. The challenge we now see with our patients that when you refer them.
After signing the contract alongside the chairperson, Jinja Regional Hospital Chairman Dr. Chintu SBT, the Jinja Hospital Director Dr. Michael Osinde sounded optimistic over the new cancer unit.
We believe that we are taking the right step in the right direction. Once we have this platform in place, we are going to educate people about this danger signs, the symptoms, how to recognize these cancers when they are still early, and any other diseases that can be recognized by the person. Do a self-examination or go to the nearest healthcare worker who can help you to assess yourself, and when that happens, then you are referred early so that all the interventions that are available to us can be given to you early enough.
I hope that this is going to be the revival of the Masoga self-help spirit. This place was different. You found people here.
The first phase is expected to cost around $5 million. When completed, the center will provide equipment to diagnose and treat tumors in a faster and more precise manner.
When this place becomes viable. So we are looking at this place as one as being a research center, number two as being a training site, and that will give us a platform not only to reach out to our population of Jinja community or the Basoga as it were, but to the whole nation. Now when we begin to give excellent care, the care will speak for itself, and then our public health department will now go full-fledged into the radio and communication, and we use all kinds of communication platforms to reach out to our communities.
The center will be more technically advanced through its imaging, motion management, and treatment delivery. This means that cancer will now be diagnosed and treated earlier, and new targets on cancer waiting times will be made ahead of schedule.
When we have partners like the Basoga Group coming on board, this is very, very important, because then with the expertise that we have at the Cancer Institute and the Ministry of Health, these efforts can be built even further, so we can help the people of Basoga. We already know that Basoga is a region that is burdened with a lot of disease, including cancer, and that most of the patients coming from this region come very late. So having a unit there will simplify many things. First of all, it will be as a launching pad to launch our campaigns of prevention and awareness of cancer into the rural areas, and then also it will help us to assess people who come when they are very sick and those who need to be referred for further treatment. Also having that effort will help especially gain or mobilize resources for building this unit and expanding these services in Jinja Hospital.
But further efforts to improve patient survival rates will be essential, and that includes early detection of the disease to help save more lives, plus sensitization of the folks. But further efforts to improve patient survival rates will be essential, and that includes early detection of the disease to help save more lives, plus sensitization of the folks.